Here we go. Welcome to another Zoom call. We have a number of questions that came in. Just a reminder to everybody to look at the member site for announcements. Starting January 1st, we're going to drop back to one Zoom call a week for a while. We always only had one Zoom call a week. So if you just started with us recently, it's just been in the last few months that we added the Monday Zoom call for multiple reasons. Just testing out Monday. We're going to drop that for now in January. May add it back, may change our time. The Wednesday time seems to be the best for everybody. It's not perfect for everybody, but it seems to be the best for everybody. So starting in January, there'll be no Monday Zoom call. Actually, starting before that, because we won't be open on Monday the 26th. So that's going to be the day after Christmas, and we won't be open on that. That's an announcement on this site as well. Secondly, understand that new laws, this has been in the plans for a year now, really. New laws made it impossible for us to do one-on-one calls with people anymore. The state boards are cracking down on that really big time. I do a lot of podcast interview practitioners, and they're telling me the same thing in their states, that they can't do one-on-one calls if they're not licensed in the state, or it's just really, really unfortunate on what's going on. Please remember to ask your questions on the member site, and remember that all of our courses now are free to all you guys. So you can go to any of the courses on our website, and you will see that if you use the same username and password that you get into the members site, you use those same username and password for any of the courses. And starting in first quarter, we're going to have an autoimmune course here, which will be valuable for some family members as well. Okay, some in-depth questions here. So this one not so in-depth, but the next one is. Vitamin C infusions are going well in northern Minnesota. So this person is from northern Minnesota. It's fantastic. They're able to get that. Found an MD willing, also willing to prescribe low-dose naltrexone. That is great. Once again, dosing opinion desired if you can. Since arrival to this program, I've had gastric peg tube placed due to ensuing starvation, distal esophageal issues. I cannot give you dosage on low-dose naltrexone, since that is a prescription medication. I can tell you what is pretty standard. Low-dose naltrexone was actually is a drug that is prescribed to help people get off of, I think, like morphine and things like addictions, but it's prescribed at like 50 milligram dosage for that. That's why it's called low dose naltrexone, because some brave doctor found that given naltrexone at a very low dose, that is 1.5 milligrams, and then titrating up to 4.5 milligrams before bed, can be a very good immune regulator. So your immune cells are, you have immune stimulating cells, you have immune suppressing cells, and I should say different chemicals in your body that will stimulate an immune response, different chemicals in your body that will calm an immune response or cause decreased inflammation. And then you have what are called T regulator cells. T regulator cells help balance your immune system. So in a case of somebody with a hyperactive immune system, now that would be typically somebody with like brain trauma, somebody with neurodegenerative diseases, somebody with autoimmune disease. So in autoimmune diseases, when it's in a flared situation, you have this hyperimmune response where a lot of inflammatory chemicals called cytokines are being secreted. So you got this hyper-inflammatory response going on, and that is really what can cause a lot of the symptoms in people that have an autoimmune disease in its flared condition. So let's use an example. Let's say I have rheumatoid arthritis, and my rheumatoid arthritis is really flared up. My hands are just really, really hurting, and it's just very inflamed and red, and it's very painful. Well, that is because you're getting this hyper release of these inflammatory cytokines. What part of your immune system balances that is what are called your Treg cells. That's short for T regulator cells. So Tregs help balance a hyper immune system. They also help balance a hypoimmune system. And it has been found that low dose naltrexone can be another exogenous Treg stimulator. So it stimulates your Treg cells so that it can help balance that. So people with autoimmune disease, some people have been helped by taking low dose naltrexone that can help calm down that inflammatory process. It's been shown to be possibly helpful with people with inflammatory disorders of the brain too. It could be helpful. Now, there's been some speculation of using it with people with cancer, because sometimes people with cancer have a very suppressed immune system, and then using low-dose naltrexone can help, acting as a T regulator, help bring that up. So that is really the use of low-dose naltrexone. Typically, the dose is started at 1.5 milligrams, taken before bed. And then if that's well tolerated, you go up to 3 milligrams and up to 4.5 milligrams. That's very well detailed in the literature. So, I'm not giving a recommendation to say what is out there in the literature. I have recently, 2 weeks ago, purchased an infrared sauna, brand name Therasage. My normal morning routine is now to drink 16 to 20 ounces of water, take Mediclay or activated charcoal with zeolite to bind toxins. So those are binders that tend to stay in the gut. Zeolite can be absorbed and can be a chelator as well. Before I begin my 30 minutes of rebounding, prior to hopping into the sauna, and then remineralize with greens and some sea salt following my sauna. I'm currently using the sauna for 30 minutes at 160 degrees. I stay inside the sauna for another 20 minutes to allow my body to continue to sweat and to slowly return to normal body temperature before I do skin brushing and then take a shower. Any info or guidelines that I should know as I continue? Well, first of all, many people cannot tolerate 30 minutes of sauning at 160 degrees. So you're able to tolerate that and really sweat. So what's the benefit of doing a sauna? Is you're sweating, you're helping to take pressure off of your liver because you're using your skin as a portal of detoxification. So that can be really beneficial. Is there a temperature, time goal to work up to that would be best for breast cancer treatment? I really think you're at that maximum. Typically, I don't recommend people do more than 30 minutes a day of sauning, and I typically recommend people to start at 140 degrees. So you're at 160, doing 30 minutes already. I certainly wouldn't do any more than that. So I think you're doing great. Kudos to you, fantastic. Personally, when I was doing a lot of sauna, I couldn't do more than 20 minutes. I just would go stir crazy. Even in my zip up sauna, I didn't have a Therasage, but I have the other brand. It's still, I just couldn't do it. A lot of people are that way. They first start to use a sauna like that, they can only do it for 5 minutes. They just can't handle it anymore. You got to go slow and work up. So you're doing great. You're kind of at the max right now. Long question. We've been on our full protocol for 8 weeks. My boyfriend, who has squamous cell carcinoma on his tonsil, has been swallowing better for at least 2 weeks now, and therefore has gained a couple of pounds. Yay. with my breast cancer, I haven't detected any shrinkage in tumor size. Is it too early? Well, remember, you might not detect shrinkage in your tumor size. So that is, the goal of cancer care, whether you're doing standards of care or alternative care, is to get it to stop growing. I mean, you can get it to stop acting like cancer. So the ultimate goal is you want your body to clean it up and to get rid of it and to dissolve it, break it down and kill those cells and then it would shrink. But some cancers tend not to do that. It just is what it is. Some cancers will just stop growing. And hey, that's a win as long as it's not blocking a lumen like in the colon or something, or impede on, blood flow or something. It's still a win. So, but you do need to. I don't know that there's an early. Is it too early to know? You just want to see some progress in at least stopping the growth. That's something that you want to be seeing. So you want to be able to have a reliable way to monitor that as well. I feel fine, but the cancer never made me ever feel sick, so I can't judge it by that. My tumor on the right is near the surface and quite large, like 5 centimeters, so it makes me nervous. But I know it was there for at least 2 years, misdiagnosed, so maybe I'm being impatient for results. I don't think you're being impatient. You want to see some change. You don't want it to be getting larger. That's the real thing. You want to, but stay the same size. If you're like, I don't notice it any different in size, but I want it to shrink. Well, then I would say, continue to be patient and continue to move forward. On the other side, the tumors are much smaller, but on the underside of my breast and closer to my chest wall, my lymph nodes haven't shrunk. I have one on each side that are larger and sometimes hurt. I don't know what to do next. Just never had to deal with anything like this. And talking to my conventional docs always terrifies me. And they're really no help because I want to go an alternative route. I don't even know if I can convince them to run any more tests because they refuse to run my tumor markers. I asked my chiropractor to do it for me. The only ones that popped was the CA 15-3 at 29.8 and 25 was the upper limit. And I did that 5 weeks ago. So if you have a tumor marker test that shows positive, meaning above the normal range, then you can use that for a marker. You can even use a tumor marker test if it's within the normal range, but it's at the high end. Or you can run your tumor markers and let's say they're all within normal range, and then you run them again, they're still within normal range, but they've changed dramatically. You certainly don't look at if it's moved 3 or 4 points, 5 points, but if it's jumped 10 points, then you start going, huh. So those are valuable things to look at. I don't know what to do next. Well, tumor marker tests are inexpensive to run, so you could run them on a monthly basis for now, if you can't really assess any other way. So be patient, do another cheek swab. I don't think doing another cheek swab at this time is necessary. Looking at some other ways to test objectivity would be something. Maybe you could, if your chiropractor can ask for an ultrasound, that would be another objective test. So maybe ask your chiropractor that. And like I said, yes, tumor markers rerun. Yes, you could do that on a monthly basis. My bone scan, MRI, and CT in mid-September didn't indicate the cancer was anywhere else, but I don't know how this works and are all the supplements, etc., I'm taking putting up a reasonable, strong shield against metastasis. Well, you're putting up the best shield you can from an alternatives perspective. Even if you did all that the oncologist has to do, still doesn't mean that's, doing everything you can from the way your body's dealing with the cancer. So there's lots of people that do everything their oncologist tells them to do, and they still get metastasis. Happens every day. So you just, are just trying to use your best judgment in moving forward. Sorry for the long question, but I need help navigating, and I don't even know what questions to ask. The practitioner who is muscle testing us each week says our organ systems are testing strong, indicating that we're on the right path. But they do not have as many of the same kind of patients. I need to watch certain videos, read certain sections of your book. Again, so please just let me know what those would be. I just don't know where to start. But I think you are moving forward. You're doing the right thing. I think the biggest thing is you want to be using your best objective way and subjective way of measuring if there's any growth. So if your tumors are very palpable, and you can kind of, with the best reasonable judgment, tell if it's growing or not, that might be your best unit of measure right now. Certainly, since the CA15-3 was positive, I would run that again. And there's value in running your other blood tests, just a CBC and a complete metabolic panel every 3 months as well. And your chiropractor should be able to order those. My oncologist doesn't like how much weight I have lost. I feel like I'm eating all the time. Potatoes, oatmeal, brown rice, pumpkin seeds, pecans, oranges. Any thoughts, any ideas? They want me to start Boost, but I'm not a fan of that. What are your thoughts? Well, I don't think Boost is really going to help you gain weight. If you are eating, it might be good to start counting your calories. If you're eating, a ton of calories and you're still losing weight, that is a concern. But there's a limited amount of things that you could do about that. I do have a video on cachexia. I have multiple. I think I have a blog post on cachexia too, that I go over some different ideas. Let me look it up really quick, and I can share it with you. Make sure it's still on our site. Yeah, cancer, cachexia, and weight loss, and another. I got three or so blog posts on cachexia. So if you just go to our main website and then you search the top of the website where you have that little hourglass thing right there, and you just search cachexia, then you'll see the multiple blog posts on that. Because that's the term that is given to a person with cancer that is eating, seemingly plenty of food, but are continuing to lose weight. So there's some hints that I give in those videos. I actually have several videos on cachexia that might help. Okay, now from the chat, I've been using my TrueLife foot mat and the metal inside the unit is rusting. Is that expected, or should I be doing something special with the water? So there is a video on the module on the both the Rife course and on the member site in the Rife section of the member site on how to clean your Ion Pro Wave. So just watch that video on how to clean your Ion Pro Wave. Now, if your Ion Pro Wave, if you used it 100 times already, probably need to replace that. But if you only used it 20 times or 30 times and you notice that, then you should probably clean it if you've never cleaned it. I use the Therasage sauna. The Therasage guy, Robbie, told me to work up to 45 minutes at 165. I normally could do this. Once I went overtime because I was distracted other days I don't last that long. I get in if I get out if I start feeling um, start feeling, I don't know, blah. So you're saying that's too long. Well, that's just my opinion. So my opinion is 30 minutes max. And yeah, 165, it's pretty hot, you know. The person who asked that other question is 160, that's pretty hot. If you can tolerate it and you are, you know, sweating good, you know, the whole purpose is to sweat. So if you can sweat at 120 degrees, then you're really 175. I don't think you're really increasing core body temperature that much more at a higher temperature. So that's the other idea of hyperthermia, is if you could increase core body temperature, you could help kill the cancer by increasing core body temperature. But it's difficult to measure, you know, really how well you're increasing core body temperature. You can certainly just take a thermometer and stick it under your tongue and see if you raise your temperature. But really, the data on core body temperature raise and killing cancer is you really have to raise core body temperature up to 304 degrees, and the chance that you're going to produce that kind of fever state, even at 180 degrees in a sauna, is pretty slim. Really, the purpose of a sauna, in my mind, is really to sweat and to help you, take pressure off your liver. In the last 3 to 4 weeks, I had very strong muscle cramp in both my legs, especially above the knees. What would be the reason? The last one was so strong I could not stand. Can this be connected to the tumor? Do I need a cheek swab? No, not really for this cramping in your legs. Could that be related to like the tumor? No, probably not. You have to think of like types of intermittent claudication, types of concerned with blood clots. You might want to go to your doctor and get that checked out for that. If it is just muscle cramping in your thighs, so you're saying it's in above the knees. If it's in the back of your legs and your hamstrings, it certainly, hamstrings are very common to cramp when you're deficient in minerals. And that's a possibility. If you just started working out and you haven't been working out, your muscles can cramp due just to blood flow issues with them. So there's multiple things that can be going on that you may want to get an examination by a local doctor. There's no way for me to diagnose that, over a chat like this. There's just too many possibilities. If you're or have been vaccinated, you got to be thinking about possible blood clots. If you haven't been vaccinated, but you're around a lot of people that have been vaccinated, you got to be thinking of shedding and blood clots. You just have to be thinking of those things. So you want to make sure you rule those kind of things out. So that my boyfriend could keep his weight up because he couldn't swallow well. We loaded up his protein smoothies with nut butter and coconut oil. Don't know if those are on your cancer diet plan, but lots of fat and calories are easy way to go. I think you're referring back to the person with the cachexia issue. Yeah, that could help with body weight too. Really, when you think of trying to keep a person's body weight or increase body weight, you got to think of carbohydrates, and it's counterintuitive with cancer, but you have to deal with the problem at hand. And increasing good fats is very good for you in a lot of ways, and increasing carbohydrates can help increase weight too. How do you spell the word that we're talking about? So I'm talking about cachexia. That's a good question. How do you spell cachexia? So you spell it like this. Cachexia. That's how I spell this. Funny word. It's Latin. Will turkey tail mushroom capsules and a dose of ivermectin now and then help with my prostate cancer? Well, turkey tail mushrooms, probably one of my favorite mushrooms, certainly a favorite mushroom for cancer, right? There's more data on turkey tail mushrooms and cancer than you can shake a stick at. So turkey tail is also called Coriolis versicolor. There's other varieties of Coriolis as well. So we use a lot of turkey tail mushrooms, and I do like other mushroom blends as well. So the only mushroom that you ever have to worry about with any type of cancer is a mushroom called lion's mane. Lion's mane is really good for your brain. It's really good to help. Actually, it's been shown to help grow neural tissue. So you don't want to use lion's mane typically with brain tumors because the thought process, and there's been no research that this has actually happened, but the thought process, if it helps grow neural tissue, could it help grow a neural cancer? So typically you don't use lion's mane for brain cancer, but you could use, but lion's mane also wouldn't be used for a cancer in the prostate or the breast. Lion's mane helps with brain function. Lion's mane is shown to help people with, even with some forms of dementia and just loss of memory, and just as we age and as we're under a lot of stress, lion's mane can be. But that's not the question. So turkey tail is a great immune modulator. All the mushrooms really are immune modulators. So but they will help when you need an immune stimulation. So they are great with any of the cancers. They are great with any infections. So maitake, reishi, turkey tail, chaga, you know, those are really, some of the great ones for all the cancers. With a dose of ivermectin, very possibly that could help that work as well. I don't know any data on that specifically taking those together, but I don't think there's any harm in any of that. There's really no downsides of using it, turkey tail. The only downside is the one I mentioned, lion's mane and brain cancer. Yes, we were doing sweet potatoes and Ezekiel bread too. I think talking about this piece here too. Do you know anything about oncoadjunct pathway 1 to 3? I am trying number 2, which has frankincense, quercetin, and curcumin. I do know about those. These are this is like a system of different specific nutrition for cancer for cancer patients. Quite honestly, I don't know how they get away with naming their products what they do. If you look at some of their other product names, I think they're going to have issues with the FDA. But these frankincense is a great essential oil for cancer. Quercetin is an anti-inflammatory flavonoid, as same as curcumin. So anybody can do a Google search on curcumin and cancer. Just search curcumin and cancer. You'll probably find 600 Google pages of research papers on curcumin and cancer. So, we get trouble recommending curcumin. I got in trouble with the state boards because it was one of my 5 faves for cancer is curcumin, and they didn't like me saying that. It's like, goodness sakes, it's your research that I pulled out to show this. It's unbelievable. Coffee enema talk again. I started doing these about 2 months ago, and my most recent CT scan shows thickening in my peritoneum. My oncologist is saying this is progress of disease. I also have other areas that all of a sudden became active again, like my liver. Could this be sensitivity to the coffee in this function? No, I just any if you have a sensitivity, even if you had a food sensitivity, it's not going to cause cancer to grow. Um, your, your coffee isn't, being even, very little coffee even being absorbed in doing a coffee enema. You're just stimulating your vagal nerve. So I think there's just a coincidence that you started the coffee enemas 2 months ago. So I don't think there's any direct correlation there. Referring to your video about glucose pyruvate, can we measure the HIF-1 in a blood test? No, not that I know of. We're really talking when we're in, so this person is talking about the HIF-1 gene that helps convert the end product of glycolysis into the product needed to go into the Krebs cycle. And when we have a lot of defects on the HIF-1 gene, then we can get a backup of pyruvic acid, and then you can end up burning that in the cell as energy in anaerobic state. So that really is the Warburg effect in process. So HIF-1 genes stimulate the Warburg effect in a cancer, and which means you're mainly using glycolysis to make energy, not using the Krebs cycle to make energy. It's an inefficient way that cancer cells can grow. And that's what's been known as the Warburg effect, since Otto Warburg discovered that way back many decades ago. And now looking at genetics, they're realizing that people that have HIF-1 gene defects tend to have a greater chance of their cancer being fed through that effect, through glycolysis. Those people should probably lower their glucose, lower their sugar content in their diet if they have cancer. There's no way to measure that directly. Is there a part of genetics test results that let us know what is fueling our cancer? Is that discovered in the genetics, covered in the genetics course? Well, no, yes and no, in a sense, that we lay that out in the genetic summary. So if we think there's a piece of your gene, so there's no way that you can just say, even if I have HIF-1 gene defects and I have cancer, there's no way you can say, this proves that you are feeding your cancer through glycolysis, therefore you should go on a ketogenic diet that would be best for you. Just because a person has genetic defects doesn't mean that that gene is necessarily expressed in a way that it is functioning, much worse than if you didn't have genetic defects. It's just a matter of reason. So when you have genetic defects in the HIF-1 gene, you have a greater propensity to that possibility that your cancer is going to be fed mainly more through glycolysis than if you didn't have an HIF-1 gene defect. So therefore, we would recommend in that person's case that doing, time restricted eating would be, better for that person. Staying off of sugar as more completely as possible would be better for that person. So that's where you can get hints or clues through your genes. You're not going to get any absolute concrete specifics, because it's impossible, because that's not how your genes work. Just because defects in a certain gene doesn't mean that that gene is expressed in a way that it's causing major problems. It just means that I have a greater propensity to have those problems that could be associated with that gene hypofunctioning. So that's how you got to look at genes. So, we would like to say, oh, because this person has this gene, you're going to have that problem, but it's just not that simple. Your body is so much more complex than that. Your body is compensating for just different gene defects, and your body is, trying to function as best as possible. So it's best to understand genetics in light of the bigger picture, and in light of you're not trying to quote unquote treat the gene. You're getting an idea with genetics and different clues that are going on with your body that, hey, maybe I should be taking more curcumin, or maybe I should be eating, this way a little bit, or maybe I look at my genetic picture with dairy. I probably shouldn't be eating dairy, so that gives you clues that way. So that's how you want to look at genetics. That's why we, give you the full report, but then we give you the genetic summary, and then we give you what we think are the best action steps. So, but it's not going to tell you specifically what's feeding your cancer. That's a functional aspect, not a hard genetic aspect. Any other questions? Okay, remember, we will be closed on the 26th. And I think right now we're going to be open the day after New Year's. So read the place orders and stuff, that shouldn't be a problem. And then remember that next week will be the last week for Monday Zoom call. So next Monday will be our last Monday Zoom call for a while. We may start them up again in the spring, but I think we can just push them on to Wednesday, your questions to Wednesday. All right, thanks for everybody for being on. Know that I'll be praying for all of you, and ask that you keep us in your prayers as well. And I love you all. We'll talk to you next week. Talk to you Monday. Bye-bye.